Good morning, everyone. I am Councilwoman Felicia Porter, representing District 10 and chairperson of the Public Health and Environment Committee. This is just a reminder to please mute or turn off all your cell phones for today's hearing. For council members today, we have Councilman Mark Parker of the 1st District.
Thank you, Madam Chair.
We also have 2 excused absences for Councilman Ryan Dorsey, 3rd District, and also Councilwoman Ramos from the 14th District. And we also have several representatives from the Mayor's Office and City Council President's Office. And for our committee staff, we have Marguerite Curran. So on today's agenda, the committee is reconvening a hearing for the oversight of the opioid restitution funds for the purpose of assessing the allocation and impact of the opioid restitution funds, ensuring that they are utilized to effectively support evidence-based strategies that benefit the city's most vulnerable populations. Given the nature of this particular topic, I think we should get started and jump right in. I'll turn it right over to Director Tatum and Director Whaley.
Good morning, Chairwoman Porter and members of the council. My name is Sarah Whaley, and I have the honor of serving as the Executive Director of the Baltimore City Mayor's Office of Overdose Response. I'm joined today by Director Elizabeth Tatum from the Mayor's Office of Recovery Programs. We'll be doing a joint presentation today on the Opioid Restitution Fund as our agencies work really closely together on this work. Next slide. This morning we'll cover several topics related to the city's opioid restitution fund. We'll start with a brief refresher on how we got to this point today. Then we'll review the status of the named organizations. We'll give a status updates on the request for proposals that is receiving applications right now. We'll provide details on the management and oversight of the grants within the Opioid Restitution Fund, and we'll discuss performance metrics that the city is using to track progress for the use of the opioid restitution dollars. And then we'll close out by discussing continued efforts to ensure continuous engagement with partners and stakeholders. Next slide. Perfect. Next slide. The city sued companies from the opioid industry for their role in perpetuating the overdose crisis here in Baltimore and won $579.9 million in settlements and awards. Within those settlements, 22 programs were named to receive earmark amounts of funding. That earmark totaled $87 million. On August 29th, 2024, Mayor Scott issued an executive order to guide the city's approach to managing the restitution fund based on national best practices. In this executive order, it established a dedicated fund where opioid settlement proceeds are kept. This is called the Opioid Restitution Fund. The executive order stipulated allowable uses, including community grants, to address prevention, treatment, recovery, harm reduction, and the social determinants of health and other harms caused by the opioid epidemic. The executive order established the Restitution Advisory Board to help guide decision-making and ensure transparency and accountability of the use of the fund, and called the city to prepare an overdose response strategic plan informed by a needs assessment that would guide investment. Next slide. As part of many of the settlements, organizations were named to receive earmarked amounts in those settlements. In this section, we're going to discuss the status of the grant agreements that have been signed with these organizations. Next slide. We've shared this visual in previous hearings, but just as a reminder of the process that we put in place to support each of those named organizations. When the settlements were finalized and announcements were made about the earmarks that would go to specific organizations, the city sent them what we called a concept form. This was a form that began a conversation with the city and the organizations about how they would like to use the funds. BC Moore then conducted site visits with all of the 22 named programs to discuss their proposed use of funds. Following those site visits with the Mayor's Office of Recovery Programs, we sent each organization a memo summarizing the site visit, their proposed uses, and our recommendations to ensure alignment of their use of funds with the Overdose Response Strategic Plan and the approved uses in the executive order. Organizations were asked to complete a risk assessment and complete an application that would outline the use of funds and how they would measure success. Once those were complete, organizations were ready to sign a grant agreement. And with that, I will pass to Director Tatum to talk us through the ORF grants.
Good morning, everyone. Good morning, Chairwoman Porter. Good morning, honorable members of City Council. My name is Elizabeth Tatum, and I serve as the Director of the Mayor's Office of Recovery Programs, and our offices work closely with Director Whaley and her team on the administration of these funds. Before I discuss both the status of the named programs and then also the community grants competitive opportunity, I'll say just a brief word about the progress that we have made in allocating and executing these grant awards. So as Director Whaley shared, the mayor published his executive order about the Opioid Restitution Fund on August 29th, 2024. However, the first tranche of funding was not made available until March 7th, 2025, when a supplemental appropriation was approved. In the 10 months since that time, the Recovery Office, together with BC Moore, has granted $39 million and counting to named programs. We've also released a competitive grant opportunity of $2 million with awards that are expected to be announced at the end of next month, February. So I want to emphasize that there are multiple programs on the ground with funding in hand and available to meet the needs of community and address the overdose epidemic. And with that, I'll talk about where we are at for the 22 named programs. As you'll see on the slide, we're representing our progress in two ways. First, by the agreements we have in place, and then secondly, by the amount of funding that is authorized and available to be used. So there are 15 named programs that have at least one grant executed. There are 2 with the agreement in development, which means they are rapidly moving towards Board of Estimates approval, 2 with applications still in process, and then 3 that are in a self-hold status, meaning the organization has been in communication with our 2 offices about the need for some additional planning time and some additional consideration before they move forward. And I'm happy to speak in more detail about those 3 programs. Next slide, please. This represents where we are at in terms of dollars within executed grant agreements. As I mentioned earlier in my remarks, $39 million is in signed grant agreements. 7.5 is in that agreement and development category, 6 million in application, 11 million in that self-hold status. And then this last category, the remaining named commitments in development. This is associated with named programs that have a portion of their award amount in grant agreement. By far, the 2 initiatives that have a portion obligated but not yet, a portion obligated but not yet fully awarded are the 24/7 outreach effort. That is a $15 million effort, and there's just been 1 contract issued thus far, and then the B Corps initiative with the University of Maryland, Baltimore. So that accounts for $22 million of that amount that you see on the right-hand side. Next slide, please. So here on the next 2 slides, we have the full list of the named programs that have signed grant agreements. So the B Corps initiative that I mentioned earlier, there's a commitment amount of $10 million, and 3.1 million of that has been obligated. We're also including the term of the agreements that we have in place and when those are expected to end. Next slide, please. Peer Navigators, that's another example of a program that is partially obligated. This initiative consists of 3 different partners. 2 have executed agreements already. The agreement with Enoch Pratt, which is the 3rd and final agreement that will bring that to $5 million, that went before the board this morning, and I believe that it was approved as part of the routine agenda. Next slide, please. So that is where we are at in executing grant agreements. When it comes to grant implementation, all of our grantees need to provide monthly status reports and monthly performance data to our 2 offices. And one of the important data points that they provide is where they're at in standing up and launching some of these programs. Some programs are really about expansion. Some programs are focused on standing up something new. We know that it takes time to build partnerships, that it takes time to hire and train staff. So of the 15 programs with agreements in place, here is where they're at in their planning and implementation process. So a few are in the exploration and planning stage, 3 are in preparation, 7 are at initial implementation, and then 5 are at full implementation. So we expect the trend to move further to the right as these programs stand up and do their important work. And then this is the detail on the named programs that are pending an initial grant. So as I shared, Enoch Pratt Free Library, their Peer Navigators program, that went before the board this morning. For Penn North Recovery for $3 million, there's a lease agreement question that we have pending with them that we want to get resolved before we move to completion. And then for More Than a Shop, we had some questions just to finalize their application and their plan for fiscal sponsorship, and we are nearly at decision point there. The 2 organizations that are in their grant application revision stage are Turk House and We Are Us. And I can certainly provide any detail or there if need be. And then self-requested hold. On Our Own Maryland, this is sort of late breaking news. They have just submitted a draft application, so we expect them to begin moving further along the path towards executed agreement. The Law Enforcement Assisted Diversion Program, that requires multiple partners to work together on scope and to work through important operational questions. So we are initiating conversations here at the start of calendar year 26, and we expect to see progress there, and then also Healing Cities. Next slide. Now I will talk about the status of the community-based grants opportunity. So as we've shared previously, along with the named organizations, we also want to provide a competitive grant opportunity to provide the chance for some of the community-based organizations that are doing important and innovative work on the ground, a chance to get access to some of these resources. So the Restitution Advisory Board, which I know Councilwoman Porter, you belong to, and the Restitution Advisory Board, which Sarah and her team help oversee and staff, they worked really hard to develop a scope for the initial request for proposals, and we have, of course, issued the very first grant opportunity at the end of October, and as proposals are coming in, they'll be evaluated by the RAB, and then funding decisions will be approved by the mayor. For the first round of community grants, there's a $2 million opportunity that opened on October 23rd, and there are 3 tiers. Again, these were scoped by the Restitution Advisory Board. So Tier 3, these are awards up to $500,000 for low barrier mobile treatment services. Tier 2, awards up to $250,000 for low barrier harm reduction services. And then Tier 1 are smaller grants up to $50,000 for low barrier social support services. And this represents our progress to date. There were 100 proposals that were submitted, and then 86 were deemed eligible. The 14 that were not eligible were not eligible because in some cases they proposed unallowable uses like abstinence-only programming or random drug testing. They didn't have 501c3 status, or they were not in good standing with the state of Maryland. So the eligible proposals were then each reviewed by a 5-person RAB team. And then based on their ranking, any proposals that achieved over 75% were sent to the full RAB to be ranked. And then based on that ranking, 19 advanced to application. So there are 19 applications that are in progress right now, and they are due to be submitted on Sunday, January 25th. We know that not all of them will receive funding. Once we have those applications, we'll take them through a disciplined process of review and scoring by the RAB. The RAB's recommendations will go to the mayor's overdose cabinet, and then the final award decisions will be made by the mayor with the expectation to announce awards at the end of February. So that window of time between the end of January and the end of February it's about a month. So we are very grateful to the Restitution Advisory Board members and their very hard work to both scope this initiative and then also to review and score these applications. Then I'll close my remarks before I turn it over to Director Whaley by just talking about grant monitoring and oversight and how our two offices collaborate together. First, I want to talk about annual planning. So this is a novel approach to management of multi-year grants. I do not believe that other city agencies have this in place, but because of our experience with ARPA and then also what we anticipate changing in the landscape over the next couple of years, we developed and then instituted this process. So at 3 months before the end of every fiscal year, grantees will be required to review their spend and progress against their work plan. They may complete their review and indicate that everything else is on track, it's proceeding as planned, and nothing needs to change for the next fiscal year. However, they may have underspend due to unforeseen implementation challenges. They may have lost an important source of federal funds, or there may be a need to change where or how they are delivering services to better meet the needs of the community or to better align with the strategic plan. We know that the federal landscape is changing. It's likely to continue changing over the next couple of years, and the needs in our city may change as well. So we have established an orderly but flexible process to allow grantees to look at their scope and budget and propose changes. And depending on the nature of the changes, some of those things may need to go to the Board of Estimates, and some may be able to be negotiated and finalized within our office and in coordination with BC Moore. So that's one important oversight mechanism that is novel. It's not something that we applied for ARPA grants. I think it would have been incredibly helpful. This is definitely a lessons learned for multi-year grants, and we think this is really going to help us be agile for some of these opportunities. And then I know before when we've come before this body in the past, or even during some Board of Estimates hearings, there have been questions about to clarify the rules of the Recovery Office and the Office of Overdose Response. We are working collaboratively on monitoring based on our respective areas of expertise and experience. So as an example, Our grantees are about to begin their quarterly performance meetings. There's a member of our team and a member of the BC Moore team who are together reviewing data that grantees have submitted, and they're collaboratively preparing an agenda and a set of questions, again, based on our two lanes of expertise. So our office is looking at compliance with grant agreement, administrative practices, compliance with our financial policies, which are also published on our website, so they're available to all, allowability of expenditures, and then also expenditure documentation. And then the Office of Overdose Response is really looking at things from a programmatic perspective. So what's the quality of programming? What are the evidence-based practices that the organization is using or should be using? And then how does the named organization or the community-based grant, how does it coordinate with the citywide response overall and align with the strategic plan? And we have a whole cycle of monitoring activities. Again, we work hand in glove together to implement those and to flag and address any challenges or issues collectively. And with that, I will pass things back to Director Whaley to talk about performance measures, alignment to the strategic plan, and some other topics.
Thank you, Director Tatum. So as Director Tatum just mentioned, around the monitoring process, grantees will be reporting on a series of performance metrics, and in this section, I'll share a little bit more detail about those metrics and where they came from. Next slide. So in my previous role advising state and local governments across the country on their opioid settlement dollars, an early lesson learned that we saw with jurisdictions that kind of immediately got their dollars and started issuing grants or spending funds, they did not have a clear runway or plan for evaluation. And some of them had not set up metrics for their awardees to report back on progress. So in wanting to set the city up for success and to be able to track outputs, show outcomes, and understand the impacts of our investments, we adopted a set of standard performance measures across all ORF grantees. Our performance measures are based on a set of indicators developed by Johns Hopkins School of Public Health in collaboration with many key public health partners, including the CDC, the National Association of Counties, and many others. The mayor's office took this list of indicators and reviewed them along with folks from the Baltimore City Health Department, made edits to that list to fit Baltimore City and our executive order, our approved uses, and just to ensure alignment with our opioid restitution fund. As part of the grant application process, grantees are given this list of measures and are required to report on measures relevant to their projects. These standard metrics will help us measure success of our investments across time, explaining the outputs, the direct quantifiable products or services delivered. They'll answer the question of how much was done. This will help inform our understanding of outcomes of our investments or the changes in knowledge, skill, or behavior that result from those outputs. So the outcomes answer the question of what changed because of what we did. And in time, we'll be able to understand the impact or the ultimate long-term or broader societal or systemic changes that the outcomes and outputs contributed to. So answering that question of what was the lasting difference that was made from these investments. Next slide. Having grantees report on consistent measures will allow us to measure performance objectively and allow for comparison across programs. This process will set us up with a solid foundation for future evaluation. And then on your screen, you'll see an example of some of these measures that grantees are reporting on. A full list of the standard measures are available publicly on the Mayor's Office of Recovery Programs website. Next slide. Next slide. As I mentioned in the background section, the executive order requires the city to create a strategic plan that addresses the overdose crisis in a way that is rooted in data. This data is collected from the citywide needs assessment that was conducted by the Baltimore City Health Department. The city released a draft of this plan over the summer, and the plan consists of 5 key priority areas with a set of strategies and activities under each priority that would advance that work. The city conducted 4 listening sessions over the summer to collect feedback on the plan, and since those listening sessions, we've been analyzing the data that we received. We received quite a bit of feedback on the plan, and we'll be re-releasing a finalized plan very soon. Next slide. There's a lot on this slide, but this slide is a summary of how the 22 named organizations and the grants that have been signed with them align with the overdose response strategic plan. As you can see, the signed contracts cover all of the activities or all of the 5 priority areas. And I'll provide a little bit more detail with some examples of how this is happening. So I'll walk through each priority area and give an example of an organization that has a signed grant agreement, how that aligns with the strategic plan, and a full list of all signed grantees can be found in the appendix section of this slide deck. So the first priority area is priority 1, which aims to help those most at risk of fatal overdose by addressing racial, sex, and age-based disparities. Next slide. Our first example shows how a grantee aligns with this priority area. So Be More Power is a harm reduction outreach organization where their teams are staffed by people with lived experience. They were awarded $2 million and have signed a contract with the city for 3 years to expand their harm reduction outreach in areas across the city with the greatest need. Their grant will also allow them to be responsive to overdose cluster data from the Baltimore City Health Department. Next slide. So this specifically, their scope is related to the overdose response strategic plan because their project will increase their harm reduction outreach efforts in geographic areas disproportionately impacted by overdose, thus addressing geographic disparities. To ensure that we're tracking outputs of these efforts, Be More Power will be reporting on a set of performance measures, including the number of outreach sites, the number of different types of supplies distributed. These output measures will help us measure outcomes like, are we increasing engagement with hard-to-reach populations, and are we increasing access to harm reduction services in geographic areas most impacted by overdose? Next slide. Priority 2 aims to ensure services work together to improve coordination across systems, eliminating silos, and improving how individuals navigate the systems within the city. Next slide. One example of this is through the grantee called B-Corps, which is a new initiative. It's a public-private partnership coordinated by the University of Maryland. The University of Maryland will work with Johns Hopkins Hospital and the Baltimore City Fire Department and a community-based organization called People Encouraging People. This project was named for $10 million, and we've signed a 1-year planning grant with them, as Director Tatum outlined. This project will increase access to low-barrier medications for the treatment of opioid use disorder through a telemedicine line, provide technical assistance to emergency departments, create and scale up community teams that can connect individuals to wraparound support, and provide follow-up care through a digital referral platform. Next slide. This partnership reduces silos per priority area 2 by engaging multiple different partners across the private and public sectors. And the use of the coordinated platform to make and respond to referrals helps to kind of break down some of the barriers within our current system that don't allow for tracking of completed referrals. So this will help make sure individuals don't get lost in our system. B-Corps metrics include the number of referrals, how many of those referrals resulted in a connection to care, and the number of users of the Goldie platform. These metrics will help us track outcomes like improved linkage to care, increased engagement, and retention in care. Next slide. Our third priority area is around confronting and reducing stigma so people feel safe asking for help that they may need. Next slide. Baltimore Safe Haven is a provider within the city that primarily serves the LGBTQI+ community in Baltimore. They were awarded $3 million in the settlement and have a contract for 3 years that will expand harm reduction, treatment, and support services. Next slide. This is aligned with the strategic plan because it helps reduce stigma. The harm reduction philosophy meets people where they are without judgment. And so through Baltimore Safe Haven's scope, they will increase access to these harm reduction services and other treatment and support services. They'll report on metrics like number of harm reduction service encounters, number of individuals provided housing navigation to get them into permanent or stable housing, and the number of individuals connected to emergency shelters. And this will help connect back to the outcome because it's related to improving trust and receiving dignity in service. Next slide. Priority 4 is around increasing access to low barrier services, particularly in neighborhoods without the adequate amount of services to meet the need there. Next slide. We've talked about the Peer Navigators program. This is a community-based initiative that provides peer support and guidance to individuals who might have substance use disorders, be facing behavioral health or mental health needs. This program is facilitated by peer specialists and peer navigator trainees who are individuals with lived experience themselves navigating challenges within our system that runs out of the Pratt Free Library. This grant supports the selection, training, supervision, and development of the peer trainees. Next slide. This is connected to this priority area and the strategic plan because by placing peers in the library, particularly in areas of high overdose, the peer navigators provide very easy to access, low barrier connection to peer support services. Peers themselves are low barrier. They are seen as trusted messengers within the city and can help get build that trust faster than formal systems can. So specific to the training of peers, we will collect metrics around the number of participants, the number of applicants, and the number of participants selected to participate in the program. This will help grow our peer workforce, which is connected to this priority area. And the last one, priority 5 of the strategic plan is related to improving the quality of services provided. Next slide. While many of the activities in this priority area in the strategic plan are really policy and systems level, I do want to talk about how some of our programs help to support this work more kind of indirectly. And so to do that, I'm going to talk about the Maryland Peer Advisory Council. MPAC was named to receive $2 million in settlements, and we've signed a contract with them for 4 years to support several activities, including peer support during reentry, peer-led a recovery cafe, and then peer-led outreach services. MPAC has been a great partner in supporting naloxone distribution in non-traditional settings. That's part of their outreach that they've proposed. This photograph on the side of the slide was taken at the ribbon cutting at the Metro stop in Penn North, where the city and the Maryland Peer Advisory Council partnered with MTA to get naloxone placed in all Metro stops across Baltimore. And I want to thank Councilwoman Porter and Councilman Torrance for attending the event and supporting initiatives like this. The components of this project that are directly connected to priority 5 involve around improving quality is really related to how MPAC's outreach teams conduct their outreach. They work to combine the knowledge of peers with the requests of individuals they're working with to find services that best fit that individual's need. So the individual is set up for success, and they're engaging with programs that are really tailored to the individual, and that will help promote quality programs. To measure this, MPAC will report on the number of individuals engaged and the number of connections to services made, the number of engagements that are retained for 1 month, 3 month, 6 month, post-release. This is connected to reentry services specifically. And these measures really, again, reflect autonomy and personal choice in program selection. MPAC's pathways are choice-driven by the individual. And so this, again, is connected to individuals going to programs where they know they're going to be successful. So that personal choice is really important. Next slide. Next slide. And finally, I want to close out our presentation by highlighting that none of this work with the Opioid Restitution Fund, with the Overdose Response Strategic Plan, could not be possible without the deliberate dedication and building and facilitation of partnerships across stakeholders. The city's efforts to address the overdose crisis are longstanding and precede the development of our office. But what we are doing is working to continue to leverage each of these partnerships with our fellow agencies, with our community partners, with providers, the various levels of government, and with each of the council members in our shared efforts to promote public health, public safety, and to end the overdose crisis here in Baltimore. Thank you again for this opportunity to testify, and we look forward to answering your questions.
Thank you so much, Director. I'd also like to recognize Councilman Torrance of the 7th District. Thank you, Madam. And also Councilman Bullock from the 9th District. Thank you, Madam Chair. So, Director, I want to thank you for your presentation. It was, for all that don't know, I had several briefing sessions with Director Whaley about really just understanding the nature of the opioid restitution funds, where they're going, how they're evaluated, the council member involvement, any type of community involvement as well for that input back into the office. And so thank you so much for meeting my expectations. And so that's going to be the genesis of the questions that I'm going to start out with. One of the major issues that we are seeing in community is that some of the organizations named may not have, from an evaluation perspective, been the best organization for said specialty. So can you share how these organizations, the 22 originally named, the ones that we are going through now, how they were evaluated from the RAB? What were you all looking for?
Thank you for this question. So I think this goes back to one of our first slides where we started with the process that we've taken with each one of the organizations to get them to the point of grant application and then grant agreement. The decision of the 22 named programs was decided by the court, by the judge, and so we worked with each one of them as they were selected to talk about how they would like to use the dollars, and then how we saw the work that they did fitting into the overdose response strategic plan. For some of the grantees, their alignment was really clear. The work that they've done, their legacy in the city was pretty clear, and so it was maybe a more streamlined process with them. For some of the grantees, there was a lot of technical assistance by our office and by the Office of Recovery Programs to work with grantees to find a scope of work that met what the organization did or could do and how that aligned with the strategic plan. So I think for some of these organizations, there was a bit more back and forth to get us to a point with them where their grant application fit with the strategic plan and what the ultimate goals for this administration and for the city are.
Yeah, and the reason why I bring that up is because I noticed that that not necessarily, I noticed the alignment with some of the organizations, but with other of the organizations, they necessarily didn't, based on their mission and their organizational structure, they necessarily didn't fit the need for the strategic planning. So was there any back and forth with those 22 named organizations from the law department, with the judge? Like, walk me through that process a little bit more, please.
So we work really closely with the law department about, how initiatives were named. Sometimes it's a specific organization, sometimes it's a collaborative. So I'll use Peer Navigators as an example. Peer Navigators is a program that has many partners. So it wasn't necessarily prescriptive of how the funds were distributed through those partners. So we worked really closely with law to make sure we were aligned with what was outlined in the settlement agreement. And then again, working with each of the partners to decide what the scope was, what they brought to the table, what they did in the program. And so worked again with Director Tatum and with our office to work through a scope of work for each one of the partners. And it was a similar process with each of the organizations as well.
If there are any issues with the scope of work as we go over the grant period, if there's any issues with the scope of work, what is the recourse for the city to kind of share that misalignment? Like, if we're noticing at 6 and 7 months that the organization, based on the scope of work that we developed, is still not aligned with the mission and vision of the city and where we're going, what is the process there? What is the recourse for the city to kind of revamp and I hate to say it, to realign and reshift those organizational funds from the settlement?
Sure. So I'll talk about this kind of from two perspectives. I think one is, as Director Whaley talked about, the grant agreement step. We, in some cases, have spent a long time with grantees negotiating what is your scope of services, what is your staffing model, do you need some technical assistance in order to deliver services according to best practice and evidence-based practice. In some cases, we have chosen to issue only a portion of the grant agreement because of readiness to implement and readiness to stand up the program. So I think we have also in some cases put guardrails in place within the grant agreement to guard against the risk of misalignment or either administrative and compliance issues or programmatic issues down the line. So I think we're doing a lot of that work on the front end. And then I think over the course of the grant process, we have multiple opportunities to observe what is happening with the grantee. They're providing a written status report to us every month. They're providing performance measures. We have the annual planning process that I mentioned. And we also have then quarterly performance meetings and site visits. So we have multiple opportunities for us to say, we need a corrective action plan, or we may need to make some revisions to your scope of work and take it back to the board. And I think the regular monitoring is going to help us get there. So
Wonderful.
Unlike ARPA, of course, this fund is time limited, but the time pressure is not as intense. And the $87 million that will be dedicated to these 22 named programs is a significant portion of the overall amount that we have available. So we want to make sure that we get it right. And the goal is not just move to a grant agreement, authorize the funds, and hope for the best. We have a process to make sure that we're doing the important work on the front end. And then if we need to slow things down during grant implementation or do a course correction, we have options to do that.
Thank you so much, Director. And so I have 3 committee requests. I'd like to see a copy of the grant agreement sent to the entire committee. I'd like to know if any organization, the 22 named organizations, if they submitted any, their scopes of work, so making sure that we had the scopes of work sent for the 22 organizations sent to the committee. And if there are any organizations from the onset that were deemed for a corrective action plan, I would like the committee to know that as well. Isaiah, you got that? All right, perfect. Yep, go ahead.
One point of clarification, would you like the scope of work just for the organizations with an executed grant agreement?
Yes. So those, the 22 named organizations, yeah.
Okay, great.
Thank you. Committee members, I'll go to you. Councilman Bullock.
Thank you, Madam Chair, for your leadership. Thank you for the detailed questions. And Director Whaley, appreciate your presentation as well. I do have the pleasure of sitting on the Restitution Advisory Board, so I want to lift up a couple of things that have come up in some of the meetings, but then also reflective of some of the priority areas that you've established. And so, again, one of the things that we talk about in terms of overdose is really harm reduction has been a key focus. I know there's also been discussion in terms of safe consumption in a different light. But one of the things that I want you to give us a little bit more background on. Some people look at it as an either or, and I don't. I look at it as a both and, right? So not just having harm reduction, but also abstinence, treatment, and recovery. Can you talk about the balancing of the two? Because again, they're not necessarily in opposition, but can you talk about the balancing of the two and how that gets reflected in the grantees and the scope of work as well?
Yeah, great question. So I'm going to come back to the example of how MPACT provides services and how this is related to quality of service, because I think this gets at what you've just said around client choice. What works for one individual might not work for someone else. And so while a 12-step program, an abstinence-only program might work for me, it might not work for you. And so providing choice for individuals of are they one, ready to get into treatment or to stop using drugs? Or is their goal to lessen their drug use? Is that a more attainable goal for that individual? I think working through that process with them, and that's really the harm reduction philosophy. So harm reduction, I think we often see it as a set of services, but what it really is a philosophy about meeting a person where they are and providing them with options that meet their goals in that moment. And a lot of times for individuals, goals that we have today grow and change, and harm reduction follows that person through their change. And so I think, again, like you've said, they are not in opposition of one another. What they actually are is one and the same, and they are options for people.
No, definitely appreciate that client choice. Again, I think it's a term that folks need to be more familiar with. One thing, just a follow up on that piece. It may not be, the exact numbers, but can you talk about how that balance shows up in the grantees and the agreements?
Yeah, so I think this is related to low barrier services and having available options of low barrier service. And what a low barrier service does is allows somebody to come in and get those options that we just talked about. So if it is a low barrier drop-in center, that individual might be connected to housing navigation or a drug treatment program, and they might select they want to go to inpatient, or maybe an outpatient option is more available to them. So I really think this shows up, one, throughout the strategic plan, but really in the types of services that we're funding and that we're promoting through the community grant and through a lot of the ORF grantees is around low barrier services that, again, have that harm reduction philosophy ingrained, where we're meeting people where they are. I don't have a count, but it's back on that chart of how the 22 or the 15 signed grant agreements align with each one of the priority areas.
Thank you for lifting that up. I just want to thank you, Madam Chair, but also thank the providers who will also show up and do this work. And as you can reference, it's complex. It's not simple, and it's a whole ecosystem that's very much interconnected. So thank you for addressing that.
Thank you so much. Councilman Torrance.
Thank you, Madam Chair. Thank you, Director. So I'm just more the accountability person. So metrics. Do we, in our grant agreement, specify the metrics that we want them to track? Because I'm going through this now with other portions of like dollars that we've awarded, the state has awarded to multiple grantees. I don't know what success looks like and what the continuum looks like without the metrics. So I'm wondering, for those persons who are choosing abstinence, do we have a common system where we will be able to track their progress? Because harm reduction is a spectrum. There are people who want to lessen their drug use. There are people who want to totally abstain. how do we track it? And then if that person goes to different programs to see where it's going, because I've met with some of our state partners, and I firmly believe like anything that we do in terms of substance use should be treated like Obamacare, where we treat people who get well and are able to have functional lives versus people who are programs that are just not efficient enough or doing the right things. So I'm wondering, how are we going to get there?
So grantees are reporting on a standard set of metrics that are related to their activities, and the standard metrics will allow us to compare across grantees and will allow us to look at long-term outcomes and impacts of our investment. So we have those metrics. I think something that is interesting and might come back to what you mentioned is the new system that we're rolling out with B-Corps, the Goldie system, which will look at referrals over time. So we'll be able to see an individual and the referrals that have been made and what referrals have been picked up. So we'll be able to see if an individual is showing retention in a program, which would show kind of long-term stability. And we know the longer an individual is engaged with treatment, the higher likelihood of success for that individual. We can also see if an individual cycles through multiple programs. And so that can give us a little bit of understanding of what programs in the city are maybe robust programs that provide comprehensive services, and which ones, I think we use the term often, like might not be a great actor in the city.
Yes. And are we tracking and I hate to say this out loud, are we tracking if they're residents of the city or not? Because this is a common issue that I'm running into with a number of my providers in my district. We are servicing people who are not traditionally city residents. So I just want to, so that we have the metrics to go to the state and say that this is not a city problem alone, but we're seeing residents from other counties that we're having to deal with. Case in point, I met 12 residents from Western Maryland in one program. 2.5 hours away, they came here because there was a treatment continuum that allowed them to be here. They didn't have it there. So how do we make sure that, and I say this because we had the same issue during COVID. Our residents had less access to hospital beds because we were literally the hospital capital of the state at one time when everyone was getting sick. So how do we maintain the system for our residents, but also make sure that our counterparts around the state are able to figure out how to help their own residents, but also allow us to help them too, because we're going to continue to run into this rub.
It's an interesting question and not something that we're asking our grantees to report on because it's not necessarily related to the services that they are providing, but I see kind of the broader impact that you're getting at. And again, I might come back to the conversation around choice. Some people want to get help in Baltimore and some people don't. And I think that goes for other jurisdictions as well. Someone from Western Maryland might not want to get help in their community, so they might come here. But I think that's a data point that we can continue to look into and explore.
I think we should, because I believe in people paying their fair share. And if our systems are inundated and burdened because of other counties not providing the comprehensive services, and people see this as an opportunity to get those services, I'll give you an example. Those residents I met were referred from a doctor from their county to come here because there were services here. They were also residents who were partaking in homeless services in Baltimore City too. So we have to think about the level of sacrifice we're making for our residents and the investment that we're making and how it's impacting the broader state, because ultimately these funds won't be here forever. So we need to figure out a way to say, hey, how do we work with the state and others to create an opportunity to continue to fund this and scale it to other counties so that we are not just the only county that's providing it. Thank you.
Thank you so much, Councilman Torrance. And I just want to make a point with regard to the advocacy component that you're talking about. Director Whaley in her presentation mentioned a few state-level partnerships that are exactly describing what you're talking about, making sure that our partners at the state level not only understand the issues that were existing here in Baltimore, quality of life, concentration, et cetera, but they are also gathering data through BHA, Behavioral Health Administration, where they are looking at the infrastructure across the state and seeing how can we bolster substance abuse and mental health infrastructure, say in like Kent County and Wycomico County, as opposed to Baltimore. And so I will tell you, I've been personally working with Director Whaley at the state level on that effect. Particularly what we're doing here at the city level is really making sure that the providers not only have quality care metrics, but also that they are ensuring that people are actually getting to the proper wellness that they want to. And so that dovetails into my next question, Director Whaley. How are we ensuring that these organizations are, one, qualified to provide this type of service, and number two, making sure that they are integrating wellness from a systemic perspective? So not just looking at 22 individual silo organizations, but how these funds can really impact the substance abuse and mental health system overall?
I'll tackle the first part of your question first, even though I have lots of thoughts.
And it's a large question.
Yeah.
I mean, it's one of the, and I'll let you speak one second. One of the issues that I find when we distribute grants throughout the entire city, we are just looking at from a Band-Aid perspective. And this committee, I want the vision of this committee to really look at how can we impact this on a systemic level, looking at quality of life, not only in treatment or outside of treatment, but also for the respective community as well. I'm sorry, ma'am.
I'll start there and to say that I think the goal of the strategic plan is really to think broadly about the city's response, the programs across the city and how they work together, which is why I think our strategic plan is a little bit different than other strategic plans or action plans that other jurisdictions have produced, where it's this agency is doing this thing, this organization is doing this thing. This is the city's plan and it's the city's response, and it's how all of the partners within the city work together. And so going back to your question around how we're ensuring that each organization that has a signed grant agreement is able to provide the services at quality, I think this goes back to the question or the answer that I gave around how we worked with each one of those organizations when they proposed a scope of work or proposed how they might use their earmarked funds. We worked with them to examine some of those things. Is this something that your organization has been doing? Is it something your organization has been doing successfully? Are you set up to do something like this? And so providing that technical assistance, having those conversations, I believe the signed grant agreements that we have now are with organizations for scopes of work that they can do successfully. And we are here to look at the monthly reports, to look at quarterly reports, to have those quarterly meetings, to make sure that they continue to provide quality wraparound services for people.
Have any of these organizations been investigated at the state level?
Director Tate?
And investigated meaning by which body?
Yeah, investigated from MDH or BHA, BHSB, some of the regulatory bodies at the state level.
We're not aware of any investigations. That's currently not part of our evaluation process. But that's a good note and something for us to consider.
Yep, thank you.
Can I add to that? The providers, the individual employees, do we have them attesting that their individual employees are not currently facing any penalty through any of their licensing boards? Because I had one provider where the doctor was facing losing his medical license because he allowed someone who was not certified to dispense medication under his own orders. And that person was also brought before the board. So I just want to make sure that, like, if we're doing, I'd rather them having an asset. Oh Lord, it was tongue tied today. an attestation that they are verifying that their staff is compliant with their boards or they're not currently under investigation as a way for us to have a stopgap, but it also allows us to verify and it's proactive.
So we don't currently in any of the signed grant agreements have treatment providers and the scope of work that they are providing for us as part of that. That's something that we will keep on our radar. I will say that I do work closely with the state and receive notifications when programs are out of compliance with the state. And I will double check, but I'm pretty sure that none of our named programs that we have signed with have a notification of compliance with the state or are out of compliance with the state.
And not just state compliance, I'm looking at also what Councilman Torrance was just alluding to was looking at the organization, if their providers are under investigation as well. All right, thank you so much. Councilman Parker.
Yes, thank you, Madam Chair. No, the last time that we got together on this, I know we see each other regularly, but the last time we officially got together in this committee for this hearing, we had some conversation about the flow of funds coming in from the lawsuits, where the current balance stood, where what we were still expecting, what was still kind of hung up with things. Particularly as then it broke down into the various categories of monies that were going to be spent supporting the work of public agencies in this area versus the named organizations that we spent a lot of time on today, versus what would be available in future budget years for use by city agencies, but also as part of the community application process that we have that initial $2 million today. So wanted to kind of follow up on in that area. I know we've covered some of it, but not everything. The total, the biggest number out there is 580 million, more or less. That's still accurate. As of this moment, how much of that has the city received? I see my friend Gabe getting ready for action.
One moment, Councilman, let me pull up my notes.
Thank you.
Director, did you have something?
I do not have that information right in front of me. I can follow up with that like later today. I apologize.
I appreciate that.
Is that an official committee request?
That is an official, yes, thank you, Madam Chair. As I understand it, kind of as we've tracked through, and I don't know if this is, we expect this to be consistent, but the percent for legal services, my understanding is it's 40%. Is it precisely 40%, or how does the legal services side of that break down? Is it different by each lawsuit because different people are handling it? Okay. Do we have an approximate sense of, across the scope of it, how much of the total in the end currently is or will be to legal fees? Again, I'm not looking to say it's too high or too low. I'm just looking for the information so I know how much is left for our purposes.
I think law or finance is probably better to answer that question, so I think we can get that. I think I just want to comment, like you said, I think it's different for each payment and will depend on kind of who handled it and how that worked. Yeah.
Sure. So then rather a percentage then, if the official request would be so far, money in, legal fees out, so far based on the solid stuff we have, not what might be, how much have we laid out for legal fees? And that seems like the concrete number to ask for, if I can make that official.
Yeah, and we are releasing an annual report, which will come out annually for the fund. We're getting ready to release the first one. It should be out shortly and will outline those figures for fiscal 25, so you can kind of see the pattern that will come out for fiscal 26 as well.
Perfect. And if you can restate your committee request, please.
Sure. How much, not percent, but dollar amount that we've spent on legal fees so far? Given that we have 88 million dedicated to the named programs, I know this budget year, based on our last conversation, we have 36 million going to city agencies. As we've seen more money come in to this point, I know we're waiting on what that official number is, but as we've seen more money coming from lawsuits, what I'm trying to get to is once the dust, well, not even once the dust settles completely, but as of this moment, after legal fees, the 88 million out, the 36 million already obligated to this year's city agencies funding, and the 2 million that we're currently in the RFP application process for, I'm curious what we're left with as of right now, and to think then about what that means both for the availability for city agencies, but also how much we expect in the next fiscal year to be available for the community-based application process.
So as you mentioned, 87 million has been earmarked. 36 million was obligated to city agencies. From what I know, we had in the account a little over 200 million. So quick math there. About half is obligated already. We are working through fiscal 27 budgets right now. So I can't speak to what will be final there. There will be funds allocated to city agencies to help with administration and oversight. And then we have to analyze kind of where we are with the account, what has been deposited, and then work through city agency budgets for programs and things like that. And then what's available for community-based organizations through competitive granting as well.
So here's the starting point then in the conversation about FY27 is the city agency side, which makes sense. We're in that budget cycle. And then there'll be a determination made on the amount that can be released in the next fiscal year for the competitive grants.
I would say they're being considered together.
Okay.
There's not a priority. This must happen first before we can decide on the amount available for competitive grants. It's really about what are the needs of the city and how do these proposed budgets align to the strategic plan.
Great. And then sorry.
I was just going to add to that, align to the strategic plan and what's already funded. So where we're seeing gaps in the strategic plan, what types of programs or what types of initiatives do we need to invest in to get us to our goals that are set out in the strategic plan.
And underneath all this, if I'm remembering correctly, and I reviewed the notes, and I'm just based on vague memory. I didn't go back and watch our last hearing, so I apologize for that level of negligence on my part. If I recall correctly, and maybe you mentioned it, but I didn't see it in the slides, how many years of sustained funding are we looking to get out of this corpus? Because that obviously plays into how much could be available in a given year.
The executive order outlines that the fund should last for 15 years.
15, okay. Right, and so that by itself then, as I recall our conversations in August, because we were still waiting on a bunch of money to come in, I know some of it has, but some of it I think still is outstanding. We weren't there yet in terms of having the quantity we needed to really invest robustly in the way we feel like we need to, or even the ways that we're currently doing. I mean, that the current burn rate for city agencies and for that is we don't have enough there to get us through 15 years, and so I'm just trying to figure out what that looks like. I appreciate your help there.
Thank you so much, Councilman. Any other questions? Councilman Bullock? Okay, I have a few last questions. Director, can you speak to how we're providing or setting up these organizations for sustainability?
I think sustainability is a really important question, so really appreciate you raising that, especially as Director Tatum mentioned, and as we are all extremely aware of the instability of other funding sources given the federal landscape. Sustainability is something that is very important, and as the councilman mentioned, we can't continue to invest in these programs in the same capacity because we will run out of money. And so working with organizations, providing technical assistance to help them explore our services billable, are there other grants they could be applying for. That's something that we have talked extensively about within our offices to help support the programs that we are investing in now, the organizations that we're investing in to ensure sustainability.
Thank you. And so my last question has to do with data tracking. So that's extremely vital in these public dollars. And so will you all have an external facing data tracking strategy so that organizations can look at these funds, they can look at kind of project abstracts to see what we are currently funding, what are the gaps and opportunities, so that for further funding opportunities, other organizations are able to see where we've been and where we're moving in the future?
Transparency is very important. It was outlined in the executive order that we have a plan for transparency. A draft transparency and accountability plan was released, and we received feedback from the community on that plan. The final draft plan is available online and includes components like the annual report that we will produce annually, and a publicly facing dashboard as well. Director Tatum, do you want to add anything about the details of the dashboard?
Sure. So our office has been working closely with the Office of Performance and Innovation on a grantee portal to collect all of the performance measures and financial data in one place, which is really important to set us up for success in publishing both financial and performance data on a regular basis in a dashboard. So that work has seen some very good progress. And then internally, we have developed a framework and an outline for the first version of the dashboard. I think if you had asked this question 6 months ago, I think we would have said, we are still standing up programs. It doesn't make sense to publish performance data for 3 grant agreements. We want to make sure that there's enough data to say something meaningful. So we are at work right now on building out the first version, which will be financial information and some of the information about our community grants process. And then version 2 of the dashboard, we're expecting to begin publishing some of that performance data. But we're doing the work on the front end to make sure that we're collecting data in a way that will make it easier to aggregate common measures together and then publish them on a regular basis without, an extensive 3, 4, 5 month process of analysis. So we want to make sure that we're collecting data in a standardized way, and then we can automate the publication of the dashboard.
Thank you so much. Do we have an ETA on when that dashboard will be completed?
We are expecting the first version to be published in February.
Of this year?
Yes.
Perfect.
Yes.
All right, thank you so much. All right, colleagues, any other questions before we transition into public testimony? All right, hearing and seeing none, we're gonna go into public testimony. Our first person is Vin McCormick. And you have 2 minutes, sir. Yeah, you can, I'll give you 5. Yes. I'm sorry, sir, if you could press the button. There you go.
Good.
And if you can identify yourself, yep.
Thank you. Good morning, Madam Chair, attending members of City Council, all those who are in chamber. Happy New Year to all. My name is Vin McCormick. I am the Executive Director of the New Life Recovery Center and also the New Life Recovery Foundation. We are a behavioral health organization here in Baltimore. We have created what I like to call a recovery campus just 3 blocks up the street in the 100 block of St. Paul Street. We also have a facility in Doc Bullock's area. Matter of fact, Doc, I don't think you know, we opened up an OTP in the 3rd quarter because what we've seen is the need for opioid assistance is in that quarter. So you'll be coming to a ribbon cutting, hopefully. It's hard to stand here and not self-promote or sound pretentious or that I'm dealing in self-aggrandizement. But what I've learned in this space, the time that I've been director of this, executive director and owner of this organization, is that sometimes you gotta go to the top of the mountain. There are over 1,000 SUDs, substance use disorder programs in Baltimore City. I got that from BHA. I'm sure Director Whaley can give a specific number. So we had a situation. That's what I like to call it. I don't give that too big a word. We had a situation back in 2025 in July. I'm sure most of you know about that if you weren't sleeping on a rock. I've counted probably 14 or 15 agencies that came out to support the effort to calm the situation and be of service. Over 1,000 licensed, but about 16 actually came out on in a time that I called your opportunity to attend the call of service. I find that troubling. I was one of the 14 folks who applied for the grant in October, and we didn't get it, and it's okay. It's okay. It was a learning experience for me. We didn't get the reasoning when they send the email that you don't make the next the next process. They don't tell you why. But I appreciate Director Willie putting up there the reasons why you may not have gotten those. But it'll be helpful, I think, Chair, that they put in, well, here's what we determined that led to your ineligibility. I think it'll be helpful going forward. So we can attend to that and address whatever that issue is. One of the things that I heard, and I want to be procedural and address you, one of the things that I heard in Director Whaley's presentation is one of the reasons for potential denial is abstinence only. I had lengthy conversation last year with Mayor's Office of Homeless Services and Director Simmons, where I was trying to be helpful and lend some housing to the need. I was told that the mayor's model is housing first. I didn't want to argue I didn't want to argue because I'm trying to be helpful, but one of the things I know, factually, and I share this with you personally, Chair, is I'm 25 years, 9 months clean myself. And so I operate experientially. One of the things I know for sure is, even if we go back to Maslow's pyramid, self-actualization is over and above physiological needs, which include housing. If we don't attend to the issue, we're just gonna give the person the opportunity to live somewhere and continue to behave, whatever that behavior is, in that new and nice space that we put them in. So I believe that those things have to be addressed together. That's what we've learned, and that's what we try and do in New Life. So one of the things I also learned, because we didn't make a profit, we didn't hit profit goals for 2025. And let me tell you why. We had several men to come to us who were sizes.
And then just 30 more seconds, sir.
30 seconds?
Yep.
4 to 6X in size 50 pants. Target and Walmart don't sell that. You gotta go to DXL. I learned that. There's no self-diagnosis code in Medicaid that allows you to go up and pay, get it from Medicaid, so you have to take that out of your pocket because men and women need to be clothed, and they also need to be fed, so there's no budget for that. So you have to create budgets for that. So I just hope that we continue to look at the agencies who are actually doing the work. Thank you for the opportunity to testify.
Thank you so much, Finn. We have Candy Kerr from the Baltimore Harm Reduction Coalition.
Good morning. I was given the chance to say I didn't want to say anything, but now that I have the chance to say something, why would I not? Good morning. I don't remember the official title, Madam Chair.
It's okay.
Okay.
Felicia.
Good morning. It was really great to hear all the things from BC Moore and your title that I cannot remember. But I think the thing that I want to say, and the thing that I always have to say whenever I come to the space, especially if it is not named out loud, is two things. First thing that I just want to bring into the room, the reason that we're getting this money is because there were so many people that were killed by overdose. And I think that's a really important thing to remember. I think that I have a tendency to lose that whenever I'm in these spaces and whenever I'm doing the work every day, even though I'm encountering people. But yeah, the reason that we're getting this money in the first place is because we have just lost so many people to overdose, and I think it's really important that those people get that money in whatever way possible. And I'm really grateful that city agencies have the ability to get that, because I know that the disruption that happens there, but also the community-based organizations that are, on the ground, for lack of better terms, that are encountering people on a daily basis, and also dealing with the ramifications of seeing those traumatic and being in those traumatic situations on a regular basis, also deserve to have that kind of money and to be compensated accurately. That's the first thing. And then the second thing that I want to name is that Mayor Brandon Scott is a giant fan of harm reduction, which I greatly appreciate. And he is also a fan of overdose prevention centers, and that is a thing that we have talked about and I talk about ad nauseum. And I just want to reiterate the usefulness and the ways in which we can address, if we had the ability to have a legally authorized in the state, I will say this and then we'll stop talking, legally authorized overdose prevention center within the city of Baltimore, we would be able to tackle not just one issue or one part of the strategic plan, but it's something that we would be able to address as many of those as possible, including the systemic aspects of it. And so I just always want to bring that to the table and put that in front of people to remind them that it might not be in the news, it might not be a thing that we're talking about, but it's a thing that we are consistently working for and pushing for. And I just want you to know. So thanks.
Thank you, Candy. All right, next we're gonna have Mr. Wilson from the Pride Center of Maryland. And thank you for being here.
Is that radio? My name is Tremor Wilson, Chief Director of the Pride Center of Maryland, as well as sit across Baltimore with a lot of different reentry and substance use programs. So I want to start by saying good afternoon, council members. I'm here today because I care deeply about what happens to Baltimore opioid restitution funds. I'm not just speaking from a theory, but I spent almost 15 years doing the work up and close, in real life, working with people who use substances through harm reduction, social work, and public health. I've been out here with folks who are just trying to survive day to day. I help people after overdoses. I sat with people who want treatment and people who don't trust systems because too often the system has failed to earn their trust. And I need to say clearly, LGBTQ people are not on the sidelines of this crisis. We are in it. National data has showed sexual gender minority communities often experience substance use at higher rates than their counterparts. And for some groups, that number is 1 in 3 people. That's not small. That is a public health alarm. The LGBTQ young people has report higher rates of substance use, often connected to trauma, rejection, and not feeling safe anywhere, especially within healthcare. It has also been a constant unclear loophole about whether city staff departments have been recommending certain organizations to be funded, and that's a problem because this wouldn't be the first time city entities went to bat for certain organizations based on relationships or perceived impact. But as a leader of a community organization, I can honestly say I don't remember a member from the Baltimore city government coming to see firsthand how my organization was actually impacting community. So when Baltimore receives restitution funds, I'm asking that the money actually shows up where it's needed most, in communities carrying the highest burden, and that means through harm reduction, overdose prevention, outreach, and housing support. And don't forget treatment. Treatment options people can actually access without judgment and without loopholes. Because for many years, cities have thrown money at crises in ways that look good on paper but has shown to lack impact in community. And lastly, I'm asking for accountability and representation on this committee because for many years, LGBTQ folks are only brought to the table when it's time to talk about bathrooms or when it's time to talk about HIV. If you want real impact, we need inclusion and systems that improve how the money is actually reaching communities properly. Thank you.
Thank you so much, Mr. Wilson. Director, talk to us about the connection between the LGBTQ Commission and the Office of LGBTQ Affairs and the RAB, please.
So we have a great working relationship with the Office of LGBTQ Affairs. We have not yet engaged them with the RAB, but we can put that on our agenda for future meetings.
Yeah, I think that would be, in not just that particular agency, but, a city agency perspective on the RAB as well. I like that. Let's talk through that. Okay. Are there any other persons in the room that would like to publicly testify today before we conclude? All right, hearing and seeing none, we'll close public testimony. want to thank you all for joining us here today for this iteration of this oversight for the opioid restitution funds. It's important that, for me, it's important and the visionary for this committee that we have an opportunity to not only have a direct account of these funds, but really understand how agencies are working and integrated within these funds, and also making sure that we have sustainable methods for these organizations in the coming years. This crisis is not going to be solved overnight. In my opinion, I don't know if it's going to be even solved in 15 years. I believe we are talking about a generational shift that will have to happen in how we develop our funding mechanisms, how we do city agencies and bureaucracy, and also how we show up as elected officials as well. So this is one of many conversations that I hope to have, and hope that the committee is excited to have a part in shaping how we are doing government, how we are governing regarding these funds in the future. All right, thank you so much, everyone. Have a great day.